Good evening, guys. Now, discussion B, we're discussing white coat effect among older adults. Now, this is addressing white coat syndrome. People tend to freak out when they see a doctor wearing a white coat. That's called white coat syndrome. So we're going to get into that for discussion B. So please join me for white coat syndrome discussion. Here we go. The term white coat effect describes the phenomenon where blood pressure BP readings taken in a clinical setting are consistently higher than those recorded during daily life. This effect is particularly relevant for older adults whose cardiovascular systems may respond differently to stress and medical environments. The article draws on data from the Jackson Heart Study, one of the largest community-based cohorts in Africa, in African American adults, to explore how this effect manifests in older populations and what it means for diagnosis and treatment. Study focus and population. African American adults enrolled in Jackson Heart Study, a landmark project examining cardiovascular health disparities. Subset analyzed participants with elevated clinic BP, which would be 140/90 mmHg, who also underwent 24-hour ambulatory blood pressure monitoring, or ABPM, the gold standard for real world blood pressure assessments. Comparison: clinic BP readings versus daytime ABPM values. Age groups: younger adults 60 years compared with older adults, which would be 60 years also. Additional subgroup: participants without diabetes or chronic kidney disease, since these conditions influence BP management guidelines. Key measurements and definitions. White coat effect. The difference between clinic BP and daytime ABPM. Clinic minus daytime. White coat hypertension. Elevated clinic BP but normal daytime AB PM thresholds examined. Particular attention to systolic BP, which is SBP 150 mm Hg, as this level strongly predicted exaggerated white coat effects. Main findings. Systolic BP. Older adults showed a larger white coat effect for systolic BP than younger adults. 60 years, about 12.2 mmHg higher in clinic. 60 years, about 8.4 mmHg higher in clinic. Among those without diabetes or CKD, the difference widened further, 15.2 mmHg versus 8.6 mmHg diastolic BP. In contrast, older adults had a similar white coat effect for diastolic BP compared with younger adults, suggesting age-related differences in vascular stiffness and autonomic regulation. Prevalence of white coat hypertension. Over 30% of participants with elevated clinic BP actually had normal daytime BP. Nearly half of older adults had clinic systolic BP at least 10 mmHg higher than their daytime readings. Predictors: higher clinic SBP 150 mmHg was a strong predictor of a larger white coat effect, even after adjusting for age, sex, and BMI. Smoking, physical activity, kidney function, and medication use. Clinical implications. Misclassification risk. Many older adults may be incorrectly labeled as hypertensive if only clinic readings are used. Overtreatment concerns. Aggressive BP lowering based on inflated clinic readings can expose older adults to risks such as dizziness, falls, and syncope, ABPM as a safeguard. Ambulatory monitoring provides a more accurate reflection of everyday BP, helping clinicians avoid unnecessary medication escalation. Guidelines relevance. Current hypertension guidelines may underestimate the importance of the white coat effect in older populations, highlighting the need for broader use of ABPM or home monitoring. Broader context. The study underscores how structural and psychological factors intersect with clinical practice. Older adults, particularly African Americans, face disproportionate risks of cardiovascular disease, yet they may also be more vulnerable to overtreatment if white coat effects are ignored. The findings call for a more intensive approach, one that balances the urgency of hypertension control with the realities of aging, psychologically and lived experience of patients. Bottom line, folks, give me 1 second, I'll give you the rest of the notes. Clinic blood pressure often overestimates true daytime blood pressure in older adults, especially systolic values. This can lead to misdiagnosis and overtreatment. To ensure safer, more accurate care, out of clinic measurements such as ABPM or home monitoring should be integrated into routine practice, particularly for older patients who clinic readings appear markedly elevated. Okay, that is your B. I'm going to take a break and I will be back on with C shortly. Give me a bit for that, please. And I'll see you guys for C shortly.